Nice to see everyone today. We'll get started obviously in a few minutes, but happy to have you here. I want to thank you for joining us during today's webinar. So I'm Cindy Prince, and I'm chair of the Delta Omega Executive Committee, and I'm hosting today's presentation. And Delta Omega is a public health honorary society, which was founded in 1924. So currently there are 132 chapters at CEPH accredited schools and programs, which have inducted over 30,000 members. So we're really excited to be celebrating our 100-year anniversary this year. And one of the ways that we're celebrating our anniversary is by hosting a series of webinars looking back at the past 100 years and featuring a public health milestone during each decade. And so you can see on the slide, this is part of our 100-year webinar series. So we've already had 3 of these webinars: influenza, on public health during the Great Depression, and protecting America's health during the 1940s. And those are all available as recordings at our website, deltaomega.org. And then, of course, we have today's webinar, which I'll talk about in just a sec. After this in April, moving on to the 1960s and the civil rights movement. And then public health in the 70s, identification of Legionnaire's disease. Public health in the 80s, a review of HIV/AIDS in the US from 1980 to today. 1990s and Hispanic health and aging. Public health in the 2000s, One Health approach. And then public health in the 2010s, the resurgence of infectious diseases. So I'm going to stop my share for a moment, and I am going to introduce our speakers today. So today's presentation is on wastewater infrastructure and drinking water quality, public health connections to water pollution of the 1950s. And it will be presented by Greg Lobin, PhD, MPH, and Stanley Samuel, MPH, who are with the Delta Gamma chapter at A.T. Still University College of Graduate Health Studies. So I want to thank you both for joining us today, and I'm going to turn this over to you.
Great. Let me share my screen and see if I can do it properly. Okay, I'm hopeful that everyone can see the presentation at this point. So we're going to talk about wastewater infrastructure today. I'd like to mention that a member of our Delta Omega chapter, Jacqueline Troxel, who's really passionate about water quality, was the individual who was most motivated to do this presentation. And she did a great job of helping with the outline and putting it together. But unfortunately, she had some personal issues that came up at the last minute, and she's unable to be here today, but I wanted to mention her. So let's move forward. You know, no one decade has a singular issue in public health. There are always multiple ones. So I want to try and locate the issue we want to talk about, both in other things taking place in the 50s, but also in things leading up to and following the 50s. So in the 50s, what types of things were important? We had polio was a real issue, 52,000 cases of polio in 52. That was a peak year. Jonas Salk's first polio vaccine in 55 was licensed. A big flu pandemic in 57 and 58, which I'm sure people in public health are familiar with, but a lot of people aren't. And it's really an interesting precursor to what took place with COVID, because it was a rapid, huge proactive effort to develop a vaccine in a short window of time, roughly from May to October, and then develop 50+ million doses that were distributed. 30 million people were vaccinated before the virus really took hold in the US. Still 20 million people were infected, and there were 116,000 deaths. There are competing accounts about how much the vaccine helped, but it was a huge public event, and the marshaling of government and private forces really was a precursor to what took place recently. Also in the 50s, cigarettes were definitively, this says determined to cause, but it's probably better say linked with cancer. So there was a definitive association. And this came about in a variety of ways. We were looking at epidemiology, animal experiments, cellular pathology, chemical analysis, there were a series of really good studies that started in the 40s, most came to fruition in the 50s, and it really started to establish the definitiveness of the link. And interestingly, the tobacco industry knew of it and agreed with it back in the 50s. Internal documents have since revealed they knew of it, with a research director saying, boy, wouldn't it be wonderful if our company was the first to produce cancer-free cigarettes, what we could do to the competition. And another stated how fortunate it was that smokers were engaging in a habit they can't break. And this was in response to their knowledge that cigarettes were a cause of cancer. Interestingly, by 1960, there was a poll the American Cancer Society found that only 33% of physicians at that time thought smoking was a major cause of lung cancer, and 43% were still regular smokers. What else was taking place leading up to the 50s and in the 50s? Medical and scientific progress. And this was a period of rapid advances in the detection of illness and the development of new drugs, including the start of a golden era of novel vaccine classes. There were all sorts of medical firsts and technological developments that influenced the public's perception of faith in science, faith in medicine, faith in technology, faith in progress, which played a role in the water issues. So in the 50s, the first dialysis program in the US, the first successful kidney transplant, open heart surgery, artificial heart valves, pacemakers, penicillin was synthesized and mass produced, oral contraceptives. They weren't licensed until 60, but they were created and effective in the 50s. Chemotherapy, and of course, the double helix of the DNA strand was discovered. So all of that influenced people's attitudes. So at the same time, the 50s and this innovation was also increasing the cost of healthcare significantly. Health assurance was not widely available. And there was a debate growing about the role of the federal government versus private enterprise in the future of medicine. And that issue of the role of federal government is a big issue in water as well. So let's talk more about water now, but we have to back up pre-1950 to really understand what took place in the 50s. So let's go way back. In the 1800s, the US was transforming from an agrarian culture to an industrialized one. You can see from the chart here, growth of major US cities between mid-1800s to 1900s. Major cities were tripling in size, and that's only to 1900. So by 1950, the change was even more dramatic. Now, what's the consequence of this? Rapid increase in population results in a strained water infrastructure, which back in the original days was really shallow wells, small reservoirs situated within urban areas. And the consequence of this was an inadequate water supply for both drinking and sewage. So the early solution was to find other sources of water, usually further away, and mechanisms to bring that water to these urban environments. But this increased availability of water had consequences as well. It increased sewage production, which flowed into rivers, lakes, and estuaries, overwhelmed the natural capacity to assimilate and purify the effluent. And as a result, as you can imagine, foul smells started to emanate from urban waterways, dead fish on shorelines, runaway algal blooms. These all became the norm. Waterborne infectious disease skyrocketed. Cholera and typhoid were rampant. Water pollution was a health issue and a quality of life nuisance, often downstream from cities because the sewage was dumped directly into rivers and it would move downstream to other communities. But city leaders really lacked the will to address the problem. They didn't want to spend the money building sewage infrastructure, and little was done. By the early 1900s, significant sums had been spent pioneering drinking water treatment technologies, and also steady improvements in sanitation were continuing. By the 1950s, these investments had substantially eradicated cholera and typhoid, at least the epidemics. And so that was a really good thing. But in some ways, it also undermined the health justification for further financial investments in water treatment, both sewage and water quality for drinking. This, by the way, transition in our water delivery system and sewage throughout the 1900s is recognized as one of the great technological accomplishments of the 20th century. The National Academy of Sciences recognizes it as one of the top 5. Well, we're talking about the middle, the 1950s. So 1948, World War II ends, and we have the post-World War II economic boom, which brings with it suburbanization, right? Families start migrating from urban centers out to rural areas near the urban centers, and these become suburban areas, and it's millions of people. And so there's a variety of drivers for this. There's the economic boom, wages are being increased, the middle class is growing, there's a desire for home ownership, there's cheap housing from New Deal legislation. There's also propaganda aimed at women saying, you know, this is more of a matriarchal role in a matriarchal community. You should get out of the workforce now. And then there are racist ideas about who belongs where. All of this pushes this mass emigration from urban environments into suburban ones. And the reality is that these environments didn't have the water infrastructure either. So it places this huge strain on the existing water infrastructure in these new communities. These are often located close to urban centers, but it requires extensive pipelines, new treatment facilities, and cities simply weren't prepared for the surge in demand from these single family homes with their lawns and their appliances like washing machines and dishwashers. So really, you've got this incredible demand for water, inadequate systems to deliver it or deal with it after the fact. Now, in addition, in the 1950s, this was a period of rapid industrialization. So this was really occurring in a time when there was a lack of public and probably even to some degree professional awareness of the need for regulation regarding the disposal of industrial waste. So at this point in time, many factories were simply discharging untreated waste directly into rivers, lakes, and streams. And they were polluting the surface waters used for drinking, irrigation, and recreation. And these discharges, as you can imagine, contained a wide range of toxic chemicals. They had heavy metals like lead and mercury and cadmium, industrial byproducts like acid and dyes and solvents, and of course, synthetic chemicals like PCBs and DDT, which takes us to this other facet of the 1950s. That is in some ways the golden era of pesticides. It's referred to as the start of the golden era of pesticides due to the extensive use and development of chemical pesticides for agricultural and pest control purposes. And public attitudes about these were largely favorable, given the promises and the marketing of the chemical companies, as well as the growing faith and trust in science and technology to improve the quality of life. We're probably all familiar with DDT. I'll talk more about that later as it ties into the blossoming environmental movement. Whoops, hey, I didn't realize I could control that. That's great. But as you can imagine, again, these pesticides were contaminating water supplies, both by direct discharge from the factories, but also runoff from application and eventually making it into the waterways. Also, many of these chemicals are persistent, so they don't break down easily in the environment, and they make their way into the water, and they contaminate that water for decades. Rachel Carson, of course, writes her famous book, Silent Spring, and gets published in '62. I'm going to talk about that later in this presentation. Another interesting development in the 50s that drew a lot of attention were river fires. And the dumping of industrial waste really led to a series of these, which eventually became high profile. The most famous of these was the Cuyahoga River, but the famous burning was in 1969. But what a lot of people don't realize is there were multiple burnings on the river in the 50s. The fire in '69, this picture is a famous picture that Time magazine used to show the river burning in 1969. It's actually an image of a much larger burn that took place in '52 that destroyed considerably more and burned considerably longer. The river fires in the '50s just didn't get the same attention. The Chicago and Buffalo rivers also repeatedly burned. The Rouge River in Michigan, which flows through Detroit, also famously caught fire in '69, but had done so multiple times in the '50s. And despite growing awareness and concern, the public almost had an acceptance of these river fires as sort of one of the features of technological advancement. As one author commenting on the Rouge River fire in '69 wrote, despite the paradox of burning water, this fire was not front page news. A local paper devoted only 3 short columns to the story, tucked deep within the issue. In the '50s and '60s, a Rust Belt river catching fire was not particularly noteworthy. These rivers received waste of industrial growth, meaning sometimes they caught fire. And along with that, the popular opinion about the importance of progress and how technology is going to save us meant that people challenging the unrestricted discharge of feces or oil or solvents or industrial chemicals were labeled anti-progress idiots, essentially. And politicians were hesitant or loath to oppose powerful industrial lobbies. But I still think it's important to note that these river fires highlight the dire state of water pollution in the US in this window of time. And eventually they do play a significant role in raising public awareness about the environmental issues and water quality issues. So we're talking about water quality. Well, if you have a growth in the population and a lack of facilities, you need to address wastewater infrastructure. So the first sewage treatment plants were actually built in the 19th century, and these largely removed solid waste from sewage, basically by letting it sit in a big pond or a holding tank and removing the sludge that settled to the bottom and the pieces that floated on the top. The liquid that remained, that was just released back into the environment, even though it was still often quite toxic. This is what's known as primary treatment of wastewater. Later, by the early 1900s, certainly the 1930s, processes known as activated sludge and trickling filter process were developed. And these relied on oxygenation within this process and the bacteria that grows there to further break down the organic matter in the water. These are called secondary treatments. They were in existence early in the 1900s. And as an aside, adding chlorine to the water to make it safe to drink was actually present in the early 1900s. The first community drinking water waste treatment plant that added chlorine was Jersey City, New Jersey in 1908. However, David Sedlak writes in his book, Water 4.0, the past, present, and future of the world's most vital resource, that by the late 1940s, only about half of the nation's sewage was actually being treated in some limited manner. And only about half of that involved secondary bacterial treatment. So most of the sewage wasn't being treated, and most of what was, or at least a good chunk of it, wasn't being treated with secondary treatment. Chlorination to treat drinking water had become more common after the 30s, so it had really helped to reduce infectious disease, waterborne infectious disease. But with the growth of the population post-1950, the lack of sewage treatment and the lack of sewage treatment plants became really obvious. By 1950, the US Public Health Service estimated that the nation's inland waterways were receiving untreated sewage from roughly 50 million people. Sewage odors were a constant presence in a wide variety of waterways: San Francisco Bay, Hudson River, the Potomac, the Mississippi, the Delaware, the Great Salt Lake, Lake Washington, and the Duwamish River in Seattle. So it was all over the place, and it was significant enough that it was catching the public's attention as a quality of life issue. Why do we have to deal with this? Something needs to be done about this. And as a result of this growing problem, communities throughout the US initiated and expanded construction of wastewater treatment during the 50s and into the 60s. Another type of sewage disposal that sort of came to the front in the 50s was what they call on-site sewage disposal, or what we know as septic tanks or septic systems. And in the 50s, the US Public Health Service attempted to create the first national standards for this. By the 40s, septic systems had become common methods of wastewater treatment in many parts of the US. However, it was pretty random. And in the 50s, states began to really adopt laws, upgrading the system design and installation practices, ostensibly to ensure proper functioning and eliminate problems. But most of the laws were inadequate. Little standardization of the state rules, they varied widely. They were based on limited knowledge, soil percolation tests, local practices, and past experiences. They failed to consider complex interrelationships among soil conditions, wastewater characteristics, biological mechanisms, and climate. And they often copied and prescribed standard designs from jurisdictions that were biologically, geographically, and climatically different than where they were. So you can imagine that they weren't very effective in many instances. Also, the design, permitting, and installation was depended on minimally trained personnel, and homeowners were then expected to operate and maintain these systems. So in '57, the Public Health Service published this first document, Manual of Septic Tank Practice, which represents the first major compilation post-World War II research, and it dramatically influences septic system codes over the next 20 years. By the 70s, those codes look largely like what we have today. Obviously, there have been changes, but the basic structures remain. So this was a pretty powerful transition in the late 50s, initiated in the late 50s. Okay. Now we're going to talk about some things that are more directly related to some later legislation. The Federal Water Pollution Control Act of 1948. Sorry, I couldn't get a more clear image of the actual cover, but you get the idea. And I think of this as a model of ineffective legislation. It really didn't do a good job. But in many ways, the 50s laid the groundwork for more well-known environmental changes and movements of the 60s and 70s, and this is part of that. Public concern led to political momentum for change in the regulation of water pollution. And this sets the stage for later legislative attempts like the Clean Water Act of 1972. The basis of the Clean Water Act of '72, which lots of people know about, is this document, the Federal Water Control Act of '48, which was revised in 1956. And it was the first major US law to address water pollution. In '56, it was amended to provide states and localities grants for construction of wastewater treatment plants. Unfortunately, as I mentioned, it wasn't well designed and it achieved very little. Major problems. It generally didn't prohibit pollution. It gave only limited authority to the federal government. It provided extremely cumbersome enforcement mechanisms. It was limited to where cases of interstate commerce were affected, which was debatable and a small subsection of the problem. And states had to prove the burden of harm. They had the burden to prove harm by regulated pollutants. So in both the late 40s and 50s, it was also difficult to gain political support for water pollution proposals or legislation, and legislators were hesitant to act in that way. So the fact that this was passed and did not just disappear, but subsequently was strengthened and eventually became one of the most powerful early environmental legislative attempts in the early 70s, I think demonstrates that growing popular and political support for pollution control efforts really started, maybe not in deep-seated, pierce the public consciousness ways, but in the 50s. And this act establishes an initial basic framework for water pollution control, and Congress continued to revise it and refine it. Just further along those lines, the 50s ushered in 30 years of water policy commissions and widespread federal involvement. This is Peter Rogers, a well-known water quality expert, in a paper, Reflections on a Century of Water Science and Policy. The 50s ushered in 30 years of future water policy commissions and widespread federal involvement in the development of methodologies for planning and developing large water projects and programs. So I want to position the 50s and the Federal Water Pollution Control Act as playing a significant role and as legislative precedent for other federal laws aimed at protecting public health, ones that we're more familiar with. And it did this in several ways. One, it established a federal role in environmental protection. So prior to the FWPCA, the federal government really didn't have an active role in pollution regulation. Certainly, it had very little control over what states did, and it did little to protect environmental quality. It also paved the way for other federal environmental laws, which expanded on its original promise, and it explicitly focused on public health. I mean, that's where it was coming from, even if it was relatively ineffective. And this sets the stage for future regulatory programs. So I don't think we can talk about a decade without talking about sort of the way it bleeds into what came afterwards. And you've seen the argument I'm trying to make. So I have a couple of more thoughts about that. The environmental justice movement is something that we are now very familiar with. And the phrase environmental justice and the environmental justice movement are phrases we're familiar with. I want to link them to what was taking place in the 50s. So the term itself, environmental justice, really gained popularity in 82. There was an incident in Afton, North Carolina, of the illegal dumping of industrial waste laced with PCBs. And there was a lot of grassroots organizing and protesting of a variety of different people involved in how this was impacting them and their communities. And they were trying to push back against powerful economic and political structures. This was in some ways the start of the language of the environmental justice and the environmental justice movement. But there's a larger framework. It really has earlier roots in the civil rights, with its emphasis on structural conditions and grassroots organizing and challenging protest strategies. It wasn't thought of the same way we think of the environmental justice movement now, but the civil rights clearly played a foundational role. And when you think about that, you can see environmental justice as a framework for interpreting structural inequality, and one that unites a variety of movements at the intersection of environmental harm and political marginalization. And that's sort of what was taking place in its nascent stages in the late 50s. The forces that propelled the environment into the limelight of American public life had been building in the 50s, and largely water pollution and sewage were drivers of that. So I might be stretching it a bit, but I still think this is a real connection that's worth emphasizing. We can think of the 50s as a really early stage in the environmental justice movement. It marked the beginnings and stirrings of concerns that would later coalesce into a formal movement. And while large-scale protests and national recognition came in the following decades, the seeds were really planted in the 50s. One more slide for me, and then I'm going to pass things along to my colleague. Rachel Carson. Most of us are familiar with her book, Silent Spring. This was published in 1962, and it played a pivotal role in sparking the modern environmental movement and raising public awareness. This is not that far removed from the 50s and the growing public consciousness that took place around water issues then, water issues, and also pesticide pollution more broadly, but really mostly how these things ended up in the water system. But her book, Silent Spring, wasn't primarily concerned with water issues. It documented the harmful effects of the widespread use of synthetic pesticides, like DDT, primarily DDT, on the environment and human health. It also, and this is really important, challenged the chemical industry. It challenged the claims they were making and their role as an authority and their honesty and truthfulness, their reliability. So it's a challenge to some of that blind faith in technology and science, which really took place during World War II and post-World War II. She questioned their marketing tactics. So this dramatically raised public awareness about environmental degradation. And although her book, as I mentioned, wasn't directly focused on water pollution, it built on that sentiment that the public started to feel like they could challenge and should challenge aspects of environmental degradation that initiated with water quality. And I think that also showed the public that there are unintended consequences and in some ways literally downstream effects to environmental degradation or to environmental pollution. And it's probably worth noting that Rachel Carson wrote two other books that were published in the 50s. One was in 51, it was called The Sea Around Us, and it was an exploration of the seas, their origin and their impact on our lives. And the other was called The Edge of the Sea, which looked at the tidal zones of many sea areas. And I think that her previous experience and career as a marine biologist and her work looking at these complex water-based systems, impacted her understanding of the interconnectedness of the environment, animal and human life, and water pollution and other environmental pollutants. So I'm going to pass this on now to my friend and colleague, Stanley, and I'm still controlling the slides. So Stanley, just let me know when you want me to move forward.
Thank you, Greg. Amazing start. My name is Stanley. So I will be going over the current situation in the water management in the country. People first reflect on the biggest thing which would come to their mind is Flint. What happened in Flint? Actually, what happened? If you reflect back, it's something like a poor decision was made in order to cut the cost. Industries were booming in that area. People migrated. At one point, Flint had about 200,000 people as residents in 1950s area. Soon after, the oil prices and other crises happened, and so the automobile industry crumbled. And so a lot of people migrated to different areas. And then the county was left with just 100,000 people. But the requirement to sustain the city was still the same. So the water was biggest problem. How can we still keep the same sustainable water? So they were getting the pipeline from Detroit. So in order to cut the cost, that governing body decided, let's take a pipeline from the Flint. And then they did not realize the Flint, the river was already contaminated, and then they did not realize that they have to filter it. So the residents get the blunt end of it, and then they were bombarded with water filled with contaminated lead. And so this is the protest. And so the government in that year, in March 2016, they said, stop giving them regular pipeline water, they have to supply bottled water to every residence. And then they went to court and they got approved that all the pipelines, they have about 10,000 pipelines, they have to be replaced with a non-lead pipeline. So they went to court and they won it. So out of the 10,000 so far, today, up to date, is only 7,500 have been replaced. But the court has still mentioned that even though you replace the pipelines, they have to be added filters. And so that the lead content is much minimal. And why am I talking about lead? Lead is used a little bit in minute in your wine, in cosmetics have it, but there is a threshold level that a human body can take. So lead can be dangerous at one point. So there is the threshold is 15 parts per billion. If it crosses more than that, yeah, you will have IQ problem, cardiovascular issues, retarded growth. So all these issues can arise just because of a small particle of lead. So for that reason, it's still ongoing case, but this is what the current situation is. Briefly moving on to the next slide is Okefenokee swamp. So the biggest thing is they are starting a mining issue there. So if mining starts in that area, the swamps are going to be all gone. Every time they start a mining issue, the groundwater, the surrounding areas get depleted. So for that reason, they are opposing the mining in that area. Back in like previously, the government agencies were warned that there can be an irreversible changes if they start mining. In the case of Sackett versus EPA, the Supreme Court leaned the agency that they can start a mining thing. And so the citizens have been urged to stop the upcoming mining industry there so that they can save the Okefenokee swamp and its existence so they can keep it for a longer time for the next generation to experience the swamp. I'm going to move on to the next. I guess our biggest pride in the country is Grand Canyon. Grand Canyon population has been increasing with the visitors and the current residents. But are the management of water resources still the same? Things have changed from 1950s to 2024, wherein drought have increased the climate due to climate change. The drought have increased, temperature have raised, climate changes, and the management have not updated so far. And there is also the problem is over location of limited water resources, and that is the biggest problem. And that's where the Grand Canyon is coming short. Every time this happens, the surrounding ecosystems get affected. And as the citizens of this country, we have to make sure there is an updated technology involved in this water management. And sometimes they say, if things are not done the right way, if ecology or ecosystem is not prioritized, and people just look into, okay, let's go to Grand Canyon as another wonder of the world, the ecosystem will crumble if the water management is not updated. And that's where we are right now. And moving on to the next slide. So groundwater. So why are we so much worried about groundwater? Back in the days, yes, they used to use groundwater, but the climate change have drastically messed up everybody's agricultural pattern. For example, if they used to grow a crop in June and expecting rain in July, this is not happening now because rain may not show up at the right time because of climate change. So farmers are relying on the groundwater. And so what happened over the past 50 years, the overuse of the groundwater resources happened. And so when the groundwater is completely taken out, then the ground above start having problems. So the biggest part is Kansas, that's a food basket. They don't have water to feed the crops, and so the bread basket is running low. Not many food crops can be grown in Kansas City. What happens if it's overplumbing in New York City? There's a depletion of pure drinking water. Phoenix is developing like anything, but the current situation is they have planned to build so many buildings and infrastructures, but the water is depleted. And so they have to stop building those construction sites because there's no water. So everything have to go on stop. Texas, California, Utah is probably the hottest area in Texas where there'll be ground cracking, there's a buckling of roads, and then fissures on earth, like the one you can see on the screen. All these structures, all these aspects are going to affect the water quality in general. The American farming industry are depleting because of the overuse of groundwater. And it's something irreversible. I am urging to the rest of the country is just be aware that the water, just be aware that the amount of water since the mankind is the same 100% of water still available, but the human population have increased the requirement of safe drinking water, and the other drinking and the water use have increased. But we have the same pool of water sitting there. So that's where the current situation is. More population needs more water, but the water content on Earth is the same, as not increased since the human race. I'm going to move next slide. And my next slide is thank you. And I'd like to especially thank Greg, my colleague, and Jacqueline, Jacqueline had initiated this concept. And so thank you all. Thank you for being a part of this webinar.
Thank you so much, both to Dr. Lobin and to soon-to-be Dr. Samuel. So I want to open this up to some questions. I know we had one question so far in the Q&A. If you do have any questions, feel free to post those, and I will pose them to our speakers. And Carice Nate had a question about, was there a political reason why the Water Pollution Control Act was poorly designed? So you had mentioned it was pretty ineffective. And what was the pushback that led to its poor design?
There were many political reasons, and you can imagine what they were. They're the same types of things that are in place today. The general population was somewhat unaware, and media coverage of environmental issues wasn't nearly as prevalent as it is now. You had powerful economic interests that were pushing back against it. And you had a really powerful anti-federal control over state decision-making attitude that really caused problems anytime the federal government wanted to impose authority over what states were able to do. And as we know with environmental issues, it's essential, because they don't stay in one state, that you have some sort of coordinated legislative structure to address these. But at this point in time, there weren't great examples of that, certainly not for environmental issues. And you were confronting powerful economic and marketing and advertising forces that were pushing back against it. So the risks to the legislators was high. And these seem to me to be the same types of issues that we struggle with politically now.
Great, thank you. Let's see, while we wait for other questions, I had a couple of questions. So, what are the current challenges and then also opportunities in addressing emerging contaminants? So we know we have new pharmaceuticals, new industrial chemicals. So what are the challenges and opportunities in addressing those within the water supply?
Detection is one. I mean, we have an ever-growing arsenal of chemicals and products, and we're doing a better job at stopping them from getting in the first place, but they still make their way into our environments. For many of them, we are unaware what their health effects are and what their environmental effects are. I mean, there's so many that we don't require testing, at least not comprehensively. So we're not even sure in many instances whether we need to protect the public from these or not. And once they make their way into the environment, it can be very difficult and expensive to figure out how do we find them. And then it's even more so to figure out how do we get rid of them once they're there. So I think the scope of our reliance on chemicals that we don't know enough about their carcinogenicity or other ways they might damage the interconnectedness of systems and environmental health and animal and plant and human life is really the major problem. And I'll just throw this thought in there at the last moment. Maybe it's something that AI will be able to help us with, because we're already seeing that AI's ability to look for patterns is really increasing the speed at which we can test for, medical consequences, but a wide range of effects or, relationships. And so maybe there's a sense here in which technology is going to save us from technology. Let's hope.
So, yes.
It'll just create another technological problem that threatens us, right?
Let me see. So I've got a couple of more questions. So this is interesting. When you were presenting, there was that image of sort of the happy homemaker spraying DDT into her cabinets. And, it struck me, as it always does with some of these old images, when we kind of, want to bang our heads against a wall and say, what were they thinking? But of course, we're probably doing a lot of things now that in 10, 20 years, people are going to bang their heads against the wall and say, what were they thinking?
Yeah.
So, what are the most pressing current water issues in the US, and in what ways are they similar or dissimilar to what was, happening in the 1950s?
Well, I think Stanley identified some of the issues, right? You've got overuse of groundwater. We seem to think it's a never-ending supply. I think that's a really pressing issue. We still deal with the pollution of waterways. We're suffering the consequences of lead-lined pipes from, lead was a really prominent tool used up until the 30s. Then it really started to get reduced, but it was still used. And actually, the Professional Association for Lead conducted aggressive advertising and marketing campaigns well into the 60s, pushing cities to still use it, right? So we've got an infrastructure that's rife with that problem, and we're going to need to address that. The infrastructure itself is very old, so it's not just lead. We've got problems with, steel pipes that were put in, and they've exceeded their workable lifetime. So we have leaks in the system everywhere. I mean, the amount of water that doesn't make it to be used in the way we want it to, because we lose it in the process of getting it there or cleaning it up or something else, is remarkable. I think we still have the federal versus state issues. I mean, the Colorado River is a great example. That's really the growth of industries and farmers all along the length of the river, just wanting to use as much of it as they can and not being able to come to agreement about how do we ration this in a way where we can save it. And that lack of cooperation between states and that lack of cooperation between states and the federal government is still a perennial problem in my mind. So those are some of them. I think in some ways the range of water issues that we have now is much broader. But I also think that some of the issues are similar in that in many ways they require the public to know about them. And that requires the media or other mechanisms to get them out. And our information, the way information gets distributed to us as a population now seems to have become more fractured. So it's not like there's one media source and it comes out in 4 different channels in the evening and we all watch it and we get a unified message. So in some ways, the population's knowledge and interest in an issue is more split. And so some of these issues that need to be addressed are going to find it hard to get sufficient media traction and sufficient public awareness for action to be, to happen about them. So I think that's an interesting component that is a little different now.
Yeah,
I
that
feel
definitely is. Sorry, go ahead.
and I feel the management, like, so you'd have to start from the grassroots. Every individual in the country have to start thinking about, we don't have enough water for the next generation, thinking in that way. And they have to start managing it. Stop wasting waters, and then from there we can pick it up. So that's the biggest thing. The whole federal government, the state government have to come together, should come together to see a better way to manage and don't waste the water.
Yeah, let me piggyback on that real quick, because it would be a shame to not mention the elephant in the room, which is climate change, right? Global climate change. So it's not only going to change weather patterns and maybe affect the accessibility of water in places where we thought we had access to it, but it's also going to create mass migration, which is going to change demands in locations. It's also going to push animal movements, which will have effect on water systems, right? So I think really the big issue, and it is different than the 50s, is the already present and increasingly exponentially approaching consequences of climate change.
And then I had, let me see, I think we've got a question here. I find sorry, I don't have this fully open, but I think this is,
I can read Chris's comment.
okay, Carice, that's what I was trying to just go
Carice?
over her, full name. So
Yeah, Chris says, I find your comments about how AI can help interesting. I wonder if people will be able to look at AI as a neutral party with no interest in the game, or if people will feel that the models can't be trusted. People may see it as an objective assessment from which we can address the problem, or might assume the model is hallucinating. Yeah, I couldn't agree more. And I don't think it'll be one or the other. It's almost impossible to predict where AI is going and how it's going to filter down into our lives and how it's going to change the way we think about the trustworthiness of information that we get. Scientists, public health professionals are going to have to struggle with, how do we message, how do we convey the way we are using AI as a reliable tool, so that people will believe that its role in these processes is in some sense objective and not just we're getting out what we programmed in because we have an agenda. And so I think it's a really interesting point, Carice.
thank you, Carice, for that. Let's see. And then I did have one more question for you, and I don't know if this is, just kind of been on my mind a little bit, as we do try to regulate, in some cases, what's going into our own water systems, to what extent are we exporting our problems? So to what extent are we sort of moving things overseas, where regulations, especially for developing countries, where regulations may not be as strict? Is that happening? And, is that becoming a problem as well?
I can't say I have a lot of firsthand knowledge about this, but given, it's just my general awareness of how international trade works now and how the US regularly takes advantage of less stringent rules in other countries to accomplish things we want. It just seems inevitable to me that if we're shipping recycling to China, or we're shipping refuse to another place that has more lax environmental regulation, then that's going to find its way into the systems. And the systems, water is a primary driver of the systems. So Yeah, I couldn't agree more. And, you know, we also have competing demands for the need for energy and electricity and modernization for a huge portion of the world's population. And we're still heavily reliant on methods of producing that energy that that pose serious risks, not just to the environment broadly, but specifically to water, both in terms of how we extract it, like fracking, for instance, but also breaks in pipelines and ships, breaking open, et cetera. So until we move away from fossil fuels and have cleaner sources of energy, this growing demand for energy is going to drive, I believe, the types of, widespread contamination events internationally. And the US is going to be playing a role in that in a variety of ways.
Yeah, unfortunately. All right. Well, I don't see any more questions. So I think we've only got a couple minutes left anyway. So I want to take just a moment to thank you both so much for really a wonderful presentation and really great discussion as well. Such a critical topic. So I'm really, really glad that you suggested to do this, offered to do this, and that we were able to host you today. Thank you for that. And
Thank you. Big shout out to Delta Omega, people who are attending. If you're not familiar with it, get on the website, look at it, encourage other people to participate. And thanks for the opportunity, and thank you for attending.
Well, thank you for the shout out as well. And thank you everyone for attending today. We have our next set of webinars, as I mentioned, are listed on our website, deltaomega.org. And so I hope that everyone will go there and sign up for the next webinars, and wishing you all a wonderful day. Thank you.